Bismillahirrahmanirrahim. Welcome guys to a new video in our series 10 minutes acute medicine series. Today we are going to discuss an important issue about adrenaline. So in the last video we discussed the prescription of oxygen in acute medicine, and today we are going to spend some time on prescription of adrenaline. So as you all know, adrenaline is a sympathomimetic drug, or it is a catecholamine that's released in the body from the adrenal medulla. And adrenaline is acting on both alpha receptors and beta receptors. However, it differs from noradrenaline in one thing. Noradrenaline acts more on alpha receptors more than beta receptors. However, adrenaline acts more in beta receptors more than alpha receptors. So it is inotropic drug, so causing increase in heart rate and contractility, and it's also a vasoconstrictor drug. So it's one of the important vasopressor medications. Our main uses of adrenaline in acute medicine include, as you all know, arrest, cardiac arrest. Number 2, anaphylaxis. Number 3, angioedema. Number 4, can be used in some patients of asthma. Number 5, in shock state as an important vasopressor. So let's start with in patients with cardiac arrest. We use adrenaline in cardiac arrest in both shockable and non-shockable rhythms. In shockable rhythm like VF or pulseless VT, we use adrenaline after the second unsuccessful shock. And in non-shockable states like asystole or pulseless electrical activity, we use adrenaline immediately. Okay. We use adrenaline in cardiac arrest every 3 to 5 minutes, as you all know. Dose is 1 milligram of 1/10,000 diluted medication. So we use 1 milligram every 3 to 5 minutes. In children, we use 1 milligram for each 100 kilograms. That means we dilute 1 milligram of adrenaline in 10 cc normal saline, and then we give 1 cc of this diluted medication for every 10 kilograms of the child. The second indication is anaphylaxis. Anaphylaxis, adrenaline is a life-saving medication in anaphylaxis, and you all know that we have a specific pen for in these patients we call EpiPen, where the patient can give himself adrenaline as needed, and if he is exposed to an allergic situations. In anaphylaxis, we give adrenaline intramuscular, okay, where anterolateral thigh. So in anterolateral part of the thigh, we give adrenaline intramuscular. sometimes can be given by IV infusion. An intramuscular dose, the adult dose is usually 0.5 milligram, okay, and can be repeated every 5 to 10 minutes as needed. In pediatric doses, before 6 years, we give 150 micrograms IM. And from 6 to 12 years, we give 300 micrograms IM. If you are going to give adrenaline by IV infusion in anaphylaxis, you can put like 1 milligram of adrenaline in 1000 cc normal saline and start at a rate of 1 to 2 cc per minute. This equals 1 to 2 microgram per minute as a starting dose. And you titrate according to the response. You increase the dose according to the response. However, the recommended is to start with intramuscular adrenaline in patients with anaphylaxis. Okay? The third indication for adrenaline in shock states. Adrenaline is a vasoconstrictor and also positive inotropic medication, so it can be used in cardiogenic shock, it can be used in septic shock, although we prefer noradrenaline in these patients because it's more strong vasoconstrictor medication. We can use noradrenaline also as a vasoactive medication in some cases of hypovolemic shock, if there is no response to fluid therapy. So adrenaline can be used in shock. Usually the usual dose we give 0.05 to 0.5 microgram per kilogram per minute. So we can start in a dose like 3 to 5 microgram per minute, and we titrate according to the response. Of course, we need to know that adrenaline may cause arrhythmias, so we have to take care in patients with ischemic heart disease and patients with acute myocardial infarctions. Number 4, we can use adrenaline in some cases of angioedema. Angioedema can occur due to many causes and can occur in response to many medications like ACE inhibitor, even thrombolysis, whatever, thrombolytic medications, whatever, streptokinase or whatever, TBA. Angioedema can happen with medications or with any other allergens. We use adrenaline in these patients where we have swelling, laryngeal swelling or swelling of the tongue, swelling in the pharynx. So usually we start with adrenaline as inhaled, or we can give it IM. The usual dose in these patients is also 0.5 milligram IM in the anterolateral side. We can use it inhaled. We start with those 0.3 milligram with inhaled with normal saline. Okay. So number 5 of use of adrenaline in asthma. Of course, in patients with life-threatening asthma, the patient with hypoxic or CO2 is normal or high, the patient starts to be exhausted, or a patient with who cannot even complete a single sentence. So a patient with a life-threatening asthma, usually we start with nebulizers, you give steroids, you give magnesium sulfate, and even you may give also non-invasive ventilations. All of these you try to avoid endotracheal intubation and mechanical ventilation. So we can use adrenaline in these patients, and also even we can use ketamine, as you know. So usually when you use adrenaline in this patient, after we have already exhausted ourselves on all other measures and there is no response, we can try adrenaline either as inhaler or IM. And usually we give the same dose like the dose in anaphylaxis. So these are the main uses of adrenaline in acute medicine or in an emergency. Asthmatic patients, cardiac arrest, life-threatening asthma mainly, cardiac arrest, anaphylaxis, giving IM, and can be given by IV infusions, and angioedema, and in shock states as a strong vasopressor and vasoactive medications, in septic shock, cardiogenic shock, and even in patients with hypovolemic shock with no good response. I hope this video was so beneficial for you all guys, and looking forward to see you in the next videos. Thank you.